Hey everyone, welcome back to I Own a Business. And today we are diving into one of the fastest growing specialties in optometry, and that would be myopia management. So if you are listening, and I think a lot of people who listen to this show are at a point where maybe they're just getting started in myopia management, wondering how do I get started? Or maybe you did start, but you're wondering how do I get more patients? I think we're going to help answer some of the most common questions that people have around this topic. So I'm joined today by Dr. Jenn Lyerly and Dr. Alecia Barnes, two doctors who've built a thriving myopia management practice in their own town. And together, we're going to bring a little bit of the science and a little bit of the practice management together. So, welcome, both of you.
Thank you so much.
Thanks.
We're excited to be on the show.
Thanks.
If you guys don't mind, maybe just get a little bit of background on you work at, I don't know if I clarified, you guys are together at the same practice, but Alicia, maybe I'll start with you and then over to Jen, just in terms of the practice and maybe just a little bit of background on you and the practice.
Okay, so I graduated from Southern College of Optometry in '96, worked at a private practice for 16 years, took a little break with my kids, and then I opened my own private practice, True Vision Eye Care, in Morrisville, North Carolina in 2013. So for a long time, it was just me. And then Dr. Lyerly, Jen joined me in 2018. Yes.
So, Jennifer Lyerly, I am an associate with Dr. Burns. And when I graduated SCO in 2011, I worked at the same group private practice, and that's where I met Alecia. And I was kind of shadowing basically under you as a new graduate doctor. And everything that I fell in love with optometry, which was scleral contact lenses and myopia management, I had really never done until those 3 months I spent with you.
Yeah.
So the only reason I'm here is because of getting to meet you so early in my career. So
Yeah. So then when I left, Jen took over my practice, and it was a private practice at that time.
Okay.
now we're back
You know,
together again.
you're
Yes.
back together again. I knew both of you way before for a while, and it wasn't for a long time. I didn't know you worked together. And I remember it was during a conversation. I forget what you guys were talking about. Like, oh, you guys actually worked at the same practice. I didn't realize that. So, but yeah, I appreciate you both jumping on, and I we can jump in, and maybe we'll start with you, Jen. Myopia management has it feels like something that was sort of a was on people's radar, but it was kind of like a niche thing for a long time, and it's grown in popularity. It's becoming much more integral to a lot of practices, and I'm just curious on your thoughts on why that is. Is it the technology? Is it awareness? Doctors obviously have embraced it more than I think when I graduated. It was this very new thing that was not doctors weren't quite sure if we should be doing this or not. But everything seems to have, as a specialty anyway, it seemed to gain a lot of traction. What are your thoughts on why that is?
I honestly think the biggest change that we saw was in 2019. We had the first ever contact lens FDA approved for myopia management. That was my side, of course. And I think that FDA approval was kind of like a doorway where people said, okay, this is something we are proactively going to talk about. It's just a different conversation when you're presenting to parents about off-label or theory, or we're looking at this research done in other countries versus, hey, we have FDA approved lens. I can fit you in right now. And I think you see the industry embracing it because of that gateway being open.
It makes a difference, doesn't it? Because I would imagine that there's some level of hesitation from moms and dads who a lot of times are the ones you're talking to in terms of the safety. So I would think the ability to lean back on that. Is that true? I mean, is there more awareness among parents, and does the FDA approval seem to have an impact in the buy-in, getting the buy-in of parents? It sounds like it does.
I think it does. I think parents are scared about their kids in contact lenses.
Yes.
It's something that is they know it's going to be a challenge. They know there's risks involved with eye infection, and when we can talk through the safety profile and have that FDA approval with it, it can help allay some of those fears about what a contact lens means for a child. So
Yeah. I think it also too depends on the demographics you're in and the population in your area. You know, like when I first opened my Morrisville office, that demographic was, they were very familiar. Like there was, you know, a Chinese population, Indian population, very aware of myopia control and a little bit more of a stigma wearing glasses. So those parents came in seeking things for what they could do to slow their kids' prescription down. And so that's kind of where I started with myopia management in Morrisville. So our other office, Leesville, is a much more established, family-oriented practice, a little bit more like traditional Southern practice, if you will. And those parents, you know, to them, oh, well, I'll just get a new prescription every year, you know, and sometimes you would talk to them about myopia management and they might look at you like you have two heads. They're like, well, everybody gets more nearsighted. It's just more normalized. And so I think starting to have the conversations, and I do think having that FDA approval is much more important for some families.
I'm curious what the initial conversation sounds like. Because again, I think this is one of those areas where when patients come in, when parents come in, they're bringing their kids. I think there's an expectation on the glasses or the contacts. That's what we're used to. That's what we're familiar with. But you only have a small window of time with patients. And to have this conversation in that small window about something they've never heard before, and we know it's not going to be 100% buy-in, but any suggestions from either of you in terms of how can I frame that conversation even if they don't buy into it today, that at least gets them to trust what I'm saying and sort of plant that seed for something they'll at least consider once they leave that day.
Steve, I'm so excited that because we are at the same practice, but we never are seeing patients at the same time. So this is like such a special opportunity for me to hear what you say, to see if I'm doing it the same way you are. So,
well, so I think back when Jenn started with me, and you know, she was very so again, that's 2019 when my sites came out. I've always gravitated more towards ortho-K because I was doing ortho-K in early 2000s at my other practice. We didn't think about orthokeratology then as much about myopia management as being able to manage their prescription and they don't have to wear glasses or contacts during the day. But I had even started some of that then. So I can remember when Jenn, we're starting patients, we're seeing them, and both of us were really excited. And we'd be like, okay, we have these new options to keep your prescription, hopefully from getting worse. And we could go into a 20, 25-minute thing, and we think we've given them all this information, and then they walk out the door and we never hear a word. And then we're 20 minutes behind. So, you know, both Jenn and I, we talked, we're like, okay, and again, we're seeing patients at different times, but we're like, okay, this is not going to work. All right. If we're going to start having myopia management consults. So actually I say Jenn is the writer of the two of us. So Jenn came up with a myopia management, basically document, giving the options. It has all of the sources and the studies on there. So we kind of went to the go-to, you know, your child has myopia. We can start with glasses. We can start with contact lenses. There's lots of things we can do now for myopia management. Here's a piece of paper. Read it. If you want to come back for a consult, let us know. And then if they're interested, they schedule their consult. And if they're not, we actually didn't waste our 25 minutes. And that's kind of where we've stuck to. But we do at least always say we have these options to plant the seed. Yes.
I do it exactly the same way. I just try to keep it like a 1 to 2 sentence. Hey, I'm diagnosing with myopia. Or maybe they already have myopia, their prescription's gotten worse. I'll say to them, you know, when I was growing up, my eyes just got worse every year. I had to get new glasses every year. But, you know, we don't have to do that anymore. Did you know that there's a way we can help reduce the chance that your child's vision gets worse? I've got a brochure if you want to read more about it. And if you have any questions, I'll follow. And I always do like a follow-up in a couple of days just to kind of say like, hey, were you interested in talking more about this? Let's get you set up for a consult.
Yeah, I like that approach. Alicia, when you were talking before, it reminded me of this old saying I heard from the sales world. So if you'll allow me to apply that to the healthcare world, in the sales world, it goes, it's not a sin to not get the sale. It's a sin to spend a long time not getting the sale.
Yes.
And I know we're not traditional salespeople, but I think that's sometimes what it feels like, especially in areas like this. So I think continuing to refine that 1 to 2 sentences, even a minute, whatever it is, but
Yep.
finding those key phrases, those key words that I think, if nothing else, at least piques their curiosity to go look
Right.
at it. You don't want them to dismiss it. You don't want to scare them. You don't want them confused. And I'm sure if we try to say too much, they leave confused, and then they're going to dismiss the whole thing. But I like that approach. If we could go back, you guys are a little bit further along on your journey of myopia management. But again, I kind of alluded in the beginning to the doctor who says, like a call I got yesterday, I'm interested in myopia management. How do I get started? Alicia, maybe I'll direct this to you. How did you get started? I mean, what point did you say we're going to do this, and what are the initial steps that you took to get this off the ground?
Well, when I opened my practice, uh, really nobody was doing atropine then. We didn't have my site. So it was pretty much orthokeratology. I didn't have a lot of patients, but I had a lot of time. So I just kind of started doing it, and then I went to Vision by Design, which was my first big conference in 2015. And then I went again in 2017. And I think one of the hardest things when anybody wants to institute something is you think you have to keep learning, keep learning, keep learning. And all of a sudden you're going to have this epiphany one day that you know everything and you can get started. I really kind of figured out you just kind of have to jump in.
It's
and start.
practicing medicine. Yes.
Yes, you just have to start, And so I would, I just started with a few and then kind of word of mouth, and it just kind of kept growing. And I love doing it. I always took the view that, I mean, I love doing optometry, but I love doing the specialty stuff. I like the challenge. I don't want to just prescribe glasses all day long. We do a lot of specialty things, but I did like the challenge, even though I will say I did stay awake or have dreams at night of my challenging cases. They'd stick and stick and stick. But I think you just have to start doing it, and you have to stay consistent, because you're never going to get good at it if you don't keep doing it. I will say, like with orthokeratology, if you're just kind of dabbling in it, or with anything, with my site, with atropine, if you don't start feeling 100% confident, you're not going to be able to educate the patients. I don't want to say sell it, because we're not selling it. You have to give them enough education and feel comfortable, but you just got to just start jumping in and doing it. If you're just dabbling, you're kind of wasting your time, your money. You're not doing the patient a service if you're really not getting to the top of the game. You don't have to be at the top of the game to get started. You just kind of pick the most straightforward patients to start with.
I think setting a protocol before you do the first bit, like know what how many times are you planning on seeing that patient back if things are going well. That's how you're going to figure out how to set your prices. Know the cost of your lens, know what the warranty is, know what you're going to do if someone loses a lens, breaks a lens. Have all of those protocols in place so that way you're not stressed and swamped by it. What do we do when something invariably like that's going to happen? And then, if you are staring at this and you're like, whoa, atropine, ortho-K, my site, like there's so much to do. I would say by far the simplest one is fitting my site, in my opinion, because we are all fitting soft contact lenses. You don't fit it any different than you fit a soft contact lens. And if you want to start simple, that's probably your simple, straightforward place to start. And then you can add these other two elements in as you're getting more confident, because not everybody is a MiSight candidate. Not everybody is going to want to do that type of lens. And so I think adding these other elements in is pretty exciting.
So another area where I think a lot of doctors get tripped up is having the pricing conversation. We sometimes are our own worst enemy in terms of determining what other people can pay or would pay or want to pay. And I'm curious, without telling me what you charge for this service, have you found anything that works better for you? I've heard some doctors say I charge monthly. I don't even mention the entire fee, and others care credit works really well for us. But is there anything that you've discovered in terms of pricing or even overcoming, I don't want to say overcoming objection, having that conversation with parents on something that is going to cost beyond what their copay is going to cover?
So I think that for our pricing, like it's evolved over time. So again, when it was just me and I didn't have a lot of patients, I probably, so again, I was doing orthokeratology, kind of charge the going rate for what was around me, and I kind of based it, like Jen said, how many visits do I think it's going to take? What type of lens am I going to need? And I would kind of relate that to how many exam slots is this taking over? All right. Because if you're not charging enough for your MySight or your atropine visits or your orthokeratology, if that cost is going to come out less than the time that you could have seen 4 or 5 exams for all of those spots that you're taking over the first year, it's not going to be worth it to your practice to do it. All right. Then throw on top of that missing a few warranties, not getting the lenses returned, not keeping up with them. That's kind of where we've set our pricing. MySight's a little bit different because it has a very set cost of goods. There's not, Ortho-K, we can kind of try different, there's lens designs that can vary a little bit. Depending on how good you are, you might not have to go through as many lenses. Your cost of goods can be really low. But with MySight, it's going to be a certain cost. You can't do it, but for like a certain amount of money.
Right.
Yeah.
Mhm.
So again, it's not worth your time for the education. Atropine, I would say we are probably below market for what we're charging for our atropine program, but we felt comfortable with the service that we're supplying, and again, Dr. Lyerly and Jenn, I will talk about that. I'm like, okay, this is our chair cost.
Yeah.
All right. We know what it costs for each 20-minute spot just to break even. So if we aren't covering at least that over how many visits we're seeing them a year, then we don't even need to do it.
Right.
So that's where we've kind of come up with our costs for each modality.
Yeah, it's a good benchmark to look at not only what is the chair cost, but also what if this were a non-specialty patient, having that as the benchmark and knowing what we're giving up, because there's an opportunity cost with everything you do, right? When you take on
Yes.
a myopia management patient, that's another person you can't have in the chair at the same time. So yeah, making sure that you're adequately compensated. Are most of your patients internal? I mean, do you guys do external marketing? Do you have people coming to you from the outside, or is it mostly internal?
Yeah, so we have social media that I'm running. So I talk about myopia management quite a bit on it. And my daughter is like, she has to be featured in most of the posts because I run a lot of things. I don't like a lot of pictures of myself all the time. So basically, I just have like constant my own child talking about myopia on our social media. We happen to practice in an area where a lot of the community has embraced myopia management. So I think early on, we were getting a lot of referrals for other doctors who weren't doing it yet. Now, most of our colleagues are doing it. They don't really need to refer myopia management to us in the same way, which is great. Like, I'm so happy that basically any doctor you're going to in our area, you're going to have this conversation. So,
Yeah. But most is internal or word of mouth.
yeah.
We're not doing a ton, we're really not doing any external. We don't run Google AdWords. I mean, it's on our website, it's on our social media.
Mm-hmm.
Yeah.
That's consistent with what I hear with most practices, though, at least with myopia management, because I think it's initially that conversation that you have with your doctor is probably going to be a lot more impactful than seeing something on social media that you've never heard of before. So I think it's kind of a long game, isn't it? Initially, if you were just getting started having those conversations, and Alicia, you mentioned the word dabbling, and unfortunately, I think that's where a lot of people, that's as far as they get with a lot of specialties. I think you just get maybe discouraged when you hear a couple of no's, or maybe your outcome, like you mentioned, don't make perfect the enemy of very good. learn what you need to learn, but then get in there and do it, and you'll and get better and just keep perfecting both the clinical side and continuing to refine the conversation and all of that. But it would seem it's kind of a snowball effect over time. You get no, 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 and then wow, somebody said yes, and they're coming back, and then that person goes out in the community and tells some other people.
Well, one thing that I've seen really a whole lot is, again, because of being a parent myself, on all these like Facebook and mom social groups sort of thing, you'll see people talking about myopia management and people asking questions and, oh, my son does it. Oh, my daughter does it. Our whole soccer team does it. Like, this is very much within the community. And once one parent does it, all the friends of that child now are being exposed to it and learning about it. And so I do think it snowballs quickly just from one parent having the experience.
Yeah. And that's what it's all about. I mean, once other people are talking about it, I just talked with a doctor yesterday who said that she's gotten, and so she's only in year 2, so much exposure out of her involvement and other patients and friends getting involved in the local Facebook community groups. And I thought about it and I said, yeah, that whenever I need a contract or something, that's the first place I go. And you trust that feedback. So yeah, having people out there and that word of mouth. What about the staff? How do you get your staff on board with talking about it, with understanding it, with their training development? How far do you go with developing them on something like myopia management or orthokeratology so that it's a team approach?
That's a hard one. We've done lots of training. We have, Dr. Wyatt, our other partner, he has these nice little, laminated sheets that we're supposed to give patients. We have a couple of employees where if I say, okay, like I've talked to them, they're going to do ortho-K, go on in, give them the pricing, finish everything up. A couple that we can count on. And honestly, unfortunately, that's about it. We are the drivers of it. Like Jenn and I and Brandon and I, we are the drivers. And so we have to be consistent about it, which is why we try to have the same message for every patient who has myopia, or they get the handout, that brochure that Jenn had made. And it's a work in progress.
Yeah. I don't think you can ever have enough staff training, right? Like, you have great staff and then invariably someone leaves or needs to take some time away. Now you have brand new staff and you're starting from scratch all over again. So staff training is just like a constant thing. But the one thing in the practice that always stays the same is like us. And so it's kind of our responsibility at the end of the day to make sure that the parents get the information that they need. And then if my staff can have a conversation and answer those questions too, fabulous. But it's just a persistent thing because it's never fully done, staff training.
Yeah, no, it makes sense. It's hard. That's one of the hardest parts of running a practice these days, with attrition, hard to find the right people, is making sure that people are trained up. But again, I think there's a certain level of, I don't want this to come out the wrong way, but a certain level of simplicity to, if I could speak specifically to one brand, would be the MySight lenses. I mean, they have, one thing Cooper has done is make the process relatively simple to a lot of other areas that you could specialize in, and even previous versions of myopia management.
Yes.
And I mean, if you don't want to make your own brochure, they have an excellent brochure that they can provide. So there's a lot of educational materials available there. And you can always leverage your rep for lunch and learns. Like our Cooper Vision rep has helped with staff training around MySight. So that's been really nice. So
yeah. And Cooper Vision is a great supporter of our practice, whether it is like with MySight, whether it is with, I use a lot of their, Paragon CRT. I use quite a bit of that. I use some of their sclerals. So we can always count on them for extra help in the background when we need it as well. But if somebody was going to just say, okay, I want to do myopia management, what's the easiest place to start? I mean, it would be MySight, because like Jenn said, they are already fitting contact lenses. You start there, but they do have to get really comfortable having the conversations, because there's going to be patients that my site isn't going to work for, ones who have astigmatism, kids who don't want to wear contact lenses, kids, different reasons. Yeah.
Jenn, I know you've been involved with some of the science, the research around myopia management. What excites you about where things are going as we look at the technology now versus where we've come from and where we're going? What is out there next in this area?
Well, it's everywhere but here. Steve, is the myopia management
Glasses. Yeah,
glasses, right?
yeah.
So like, I think everyone who is participating in myopia management on the optometry level, like waiting this long for myopia management glasses is truly painful. And so maybe 2026 will be the year. I don't know. The FDA has a ton of data to review and look at. I know they just had like an 8-year study data with the Essilor lens that got published this past summer. So there's a lot of available lenses everywhere else but here. And we have patients, I feel like constantly now, that have myopia management glasses they've gotten in another country. Yes. That they're coming into my exam with. And I'm like, well, I can't get you those here. So
I had a patient who figured out a way to get them from Canada. We had been approached about that. We were a little bit on the fence about that since it's not FDA approved. We chose not to go that route. We tell patients, I'll tell patients where they can get them. You can get them in China. You can get them in
Canada, Europe.
Yes.
Everywhere.
So
everywhere but here.
And some of them, if they're really that serious about it, that's what they do. Again, some of them are just not, they don't want to use drops. They don't want to use contact lenses. They want glasses, and they're going to get some glasses. The ones who are super serious.
The glasses are a total game changer, right? Like it's not a chemical entering your child's body. It's not a contact lens. I feel like that we talked about 2019 with the FDA approval on my site being a big gateway opener. The glasses is the floodgates, okay? Because there's no reason not to prescribe glasses to help keep kids' vision from getting worse.
Yes.
And that's one of the big objections, isn't it, from parents who are the emotional side of it. They'll say, I don't know if my kid is ready for contacts. I didn't know my kid could wear contacts. Like Justin Kwan always says, kids do hard things. So sometimes that conversation needs to take place to help parents come at ease or be at ease with the idea of them wearing contacts. But it sort of removes that barrier. What do we know about the glasses? I haven't really kept up with the research in terms of outcomes. Is it similar, better, the same,
the
worse?
Outcomes are good.
Very similar. I think, so I'm just picking back on of some of the Essilor data because it was more recently published. So the Essilor Stellus lens, I think they were reporting like a 65% myopia management effect within the first year of wear. I think that it cools a little bit with time. I don't know that I think with all of our myopia management tools, whether it's Ortho-K, Atropine, or MySight, I consider them to be equivalent in effectiveness. Each person is unique. What's most effective for you may be different. I'm not saying that each of these options would be equally effective for you, but on paper, there's not one that's a superior myopia management effect than the other. And I think glasses will be equivalent to all of them based on the study data I'm seeing.
Well, thank you guys so much. I'm curious if we could close out here for somebody listening who's thinking about getting started with myopia management. And maybe this question's fresh in my head because I just got it yesterday, is where do I get started?
There's a lot of resource. Like in just terms of the science of it, where have you?
I think an easy place to get started. So the AOA has this thing called the Myopia Collective. It is free to become a member. You get emails with information, with new updates on the science of the field. The AOA is doing a really big job embracing myopia management as a standard of care in optometry. And so I think that's the easiest first place to start. Get on that free email list at Myopia Collective with the AOA. And then if you are a person who's really wanting to learn how to fit lenses and understand the science of fitting lenses at that next level, Vision by Design
Right.
is the place to go. I didn't feel comfortable fitting Ortho-K until after Vision by Design, because I am one of those people more that's like, I'm not going to do it until I feel like I know a lot about it. And so that made me comfortable enough to get going.
Right. And if you're looking at the specifics of the fitting versus the specifics of the myopia management, you're not the myopia management. I guess there's also the Brian Holden.
Oh yeah, Brian
and
Holden
Brian
Vision
Holden
Institute.
Vision Institute. They have little calculators. Don't love them, but if patients like data, but you can go to the, Paragon CRT has great tutorials on fitting the lenses. Well, if you really wanted to get into it, you could go to Wave, which is probably more personalized. You can do more with it. Probably not the greatest place to start. Paragon is probably the most straightforward, great consulting. That's probably the best place to start. And then one thing we actually haven't talked about, which we have added in both of our practice, is we have a TopCon Maya. So for axial length measurement, I think too, especially as you go along over time, you make tiny little incremental changes to kids' prescriptions. But in the past, we really couldn't see what was going on, but we can now, being able to measure the axial length. And we do measure the axial length. I do now actually on all of my myopic kids, even if they're not doing myopia control. Every kid who comes in now, we are pretty much taking an axial length. And it's an expensive piece of equipment. We were trying to send people to the other office, but we were doing it so much, we just have one in both offices now.
I think this is a conversation that I'll get asked about quite a bit, Steve. Is like, well, I don't want to do myopia management yet. I don't want to get started because I haven't bought something to do axial length. Absolutely do not wait to have axial length to start. I mean, unless you're a research institute and you're trying to publish study papers. Okay, yes, you probably need to have axial length. But if you're trying to help patients, you don't have to have axial length. But if you do want to take your practice to the next level, axial length does answer a whole lot of questions for parents. It really puts it into perspective. We're talking about how long the eyeball is and what a long eyeball, like really getting an understanding of what that means to the health of the eye. And then with Ortho-K, it's the only way to tell how much the eye is changing. And if you're doing Ortho-K for myopia management, only axial length is going to tell you how successful you are.
Yes.
Well, thank you guys so much. Vision by Design, I've been to, I think I was at the second year, so we're going way back, but I'm actually speaking at it this year, which is odd because
I saw that. It's in
I've
Texas.
never fit a myopia management patient, but I'm talking about, it's in Florida.
Oh, Florida. Oh, yeah. Yes. Yes. I did see that. Yes. Could not make it this year. Yes. Yeah.
I'm talking about something else. I mean, the communication side of things. I let smart people like you talk about all the clinical stuff. So I'm talking about the communication side. But so many good things here and great feedback on where they can get educated. But I love the point about don't wait. Don't let perfect become the enemy of very good. Just get started. I think that's so important. I think that's what holds people back because, I got to go to one more conference. I got to learn a little bit more, but just get in there. And I would add, like we're doing right now, as I'm learning from you, is talk to people, whether it's at these conferences or doctors that you see, call up people, shadow somebody. I always tell people, go shadow somebody who's preferably outside of your competitive area. Drive 2 states over if you need, but go find a practice where they're doing it well and they've made the mistakes. They've learned from it, and that can save you a lot of time and probably a lot of money as well. So I love the fact that this specialty has continued to grow because I do think it's really important, and I'm glad to see that more doctors embracing it and more the little ones and their parents embracing it too. So thank you guys so much for sharing your time.
Yeah.
Thank you. It was a pleasure.
Thank you for having us.
Thanks, guys. And appreciate my 2 guests. And thanks everyone for listening. We will see you in the next episode.